$3.85 million in funding dedicated to supporting our emergency medical services across the province through the Medical First Response Program. This will be done through 2 investment streams, each targeting areas of improvement within our EMS system. So these investments will directly benefit more than 200 medical first response partner agencies across our province, including the Gibbons Fire Department. These agencies are an essential part of our emergency response network and are heroes to those in their times of greatest need. They provide critical care to our loved ones when every second counts. Many of these responders are volunteers and are sometimes pulled away from their day-to-day lives at a moment's notice to rush into the unknown. And I just want to take a moment to say thank you to anyone who has stepped up to help their community in this capacity. And I know some of them are here today, so thank you so very much. Through these targeted investments, we hope to empower first responders and provide them with the resources they need to help them perform their life-saving work. The first part of this support will be made available through the Training and Equipment Fund and building on the previous success of the Medical First Response Program. The Medical First Response Training and Equipment Fund has expanded by $1.35 million this year to now include medium and large agencies, including fire departments, remote and rural municipalities, and Indigenous communities already engaged in the Medical First Response Program. So this expansion underscores our commitment to increasing efficiency and accessibility to emergency care. A total of 117 medical first response agencies will benefit from this funding, enabling them to acquire essential equipment such as modern automated external defibrillators, trauma bags, CPR mannequins, and facilitating instructor development and frontline response training courses. So these investments will enhance the effectiveness of our first responders and improve patient outcomes province-wide. Recognizing the unique challenges faced by rural and remote communities, we also introduced the Direct Financial Support Program aimed at supporting 183 medical first response agencies with a dedicated funding pool of $2.5 million. This initiative will ease financial burdens associated with delivering emergency services in these areas, ensuring equitable access to life-saving care for all Albertans, no matter where they live in our province. We are at a crucial moment in healthcare in Alberta as we move forward with our work to refocus the healthcare service delivery model. As part of this effort, we're prioritizing reducing EMS response times and enhancing access to care in rural areas across the province. Ensuring timely access to high-quality healthcare in rural areas and Indigenous communities is vital to improving healthcare delivery and patient outcomes. Prompt response times can make a life-saving difference in emergencies such as heart attacks, strokes, or traumatic injuries. Improving access to care in these communities will help bridge healthcare disparities between urban and rural populations, ensuring that everyone receives timely treatment. By addressing the specific needs of rural Alberta, we can build a more resilient and unified healthcare system that meets the diverse needs of our population. This approach will require continued collaboration between our government, healthcare providers, EMS agencies, and community partners to effectively implement and sustain these changes. The Medical First Response Program embodies our collective commitment to excellence in emergency care provision and reflects our dedication to the well-being of Albertans. As we move forward, we remain committed to strengthening emergency medical services and safeguarding the health and safety of every Albertan. Together, we can make a real difference in the lives of all Albertans.
We very much appreciate government support and action on EMS priorities and helping us expand this funding to our partners. MFR responders are important partners that co-respond with EMS to many 911 emergencies across the province, providing on-scene support prior to EMS arrival and working as a team once paramedics arrive. They're key in the chain of survival and a valued partner by all paramedics. AHS EMS is committed to working with medical first responders their municipalities and Indigenous communities to ensure residents have access to high-quality service when and where they need it. The Minister has outlined new funding available, and our partners here in Gibbons are receiving funding from both the streams the Minister outlined, helping this dedicated team to continue to bring the best service to their community and in the surrounding area. We greatly appreciate all of our MFR partners and the people that do the work every day across the province and working alongside paramedics. We know that together we continue to work to bring emergency care to Albertans when and where they need it.
It's a great honor to have the Minister come to this location to announce a new era in medical first response. The Gibbons Fire Department has been involved in medical response since 2016. This program enhances the medical services not only for the residents of Gibbons but to all Alberta. By having first responders showing up when the ambulance partners are en route or need that extra set of hands to assist them is an asset that we all really appreciate. The increased funding will help us train more firefighters in medical response, enable us to have a larger amount of skilled members to better assist with not only medical first response, but all responses requiring medical assistance. I look forward to continuing this service, working side by side with Alberta Health Services to ensure people of Alberta continue to receive the care they need when and where they need it.